Beta blockers have long been a staple for heart attack survivors, reducing heart stress by blocking adrenaline. They lower heart rate and blood pressure, believed essential post-heart attack. Historically, they were prescribed based on older studies showing benefits. However, modern treatments like angioplasty and statins have changed recovery dynamics. This shift raises questions. Are beta blockers still necessary for everyone, or are they an outdated prescription? Medicine is a field in constant motion, always evolving as new discoveries and technologies emerge. What was once considered cutting edge can quickly become outdated as our understanding deepens and fresh evidence comes to light. As a result, our clinical practices must adapt and transform, ensuring that patients receive the most effective and up-to-date care possible. One area currently under the microscope is the routine use of beta blockers after a heart attack. For decades, these medications have been a cornerstone of post-heart attack treatment, prescribed almost automatically to patients leaving the hospital. However, new clinical trials are now underway, designed to rigorously test whether beta blockers are still necessary for everyone, especially in the context of modern therapies and improved patient outcomes. These studies are focusing specifically on patients who have normal heart function after their heart attack, people who, thanks to advances in care, may not benefit from the same treatments as before. The results of this research could have far-reaching implications, potentially redefining how millions of people are treated and challenging long-standing medical norms that have guided care for generations. Ultimately, the goal is to ensure that every treatment we offer is truly necessary, genuinely beneficial, and tailored to the needs of each individual patient. This new wave of research is essential, not only for refining patient care, but also for eliminating unnecessary medications, reducing side effects, and improving quality of life for those recovering from heart attacks. Recent trials reveal a shift in beta blocker efficacy. Reduce AME and Reboot found no significant benefit in modern patients. Beat-Me Dan block showed a slight reduction in non-fatal heart attacks. However, the overall impact on mortality was negligible. The evidence suggests beta blockers may be redundant for most with strong heart function. This challenges the long-standing practice of universal beta blocker use. Modern therapies may offer sufficient protection without them. For patients whose heart function is only mildly reduced, the clinical landscape becomes more complex and less straightforward than in those with more severe heart failure. These individuals often fall into a gray area where the best course of action isn't always obvious, and treatment decisions require careful consideration of multiple factors. Recent meta-analyses have suggested that beta blockers may offer a modest benefit for this group, potentially improving outcomes such as reducing hospitalizations or slowing disease progression. However, the degree of benefit is not as pronounced as in patients with more significantly weakened hearts. The absolute improvement seen in studies is relatively small, which means that while some patients may experience positive effects, others may not notice much difference. This subtlety urges clinicians to interpret the data with caution and avoid overgeneralizing results. Adding to the challenge, ejection fraction measurements, the key metric used to assess heart function, can fluctuate over time or vary between tests, making it even harder to determine the most appropriate treatment path for each individual. Because the evidence supporting beta blocker use in this population isn't robust enough to create a universal guideline, medical teams often find themselves debating the best approach for each patient. Ultimately, treatment should be tailored to the individual, taking into account their overall health, other medical conditions, and how well they tolerate medications. This underscores the importance of nuanced patient-specific care, where decisions are made collaboratively and thoughtfully, always prioritizing the unique needs and circumstances of each person. As of 2025, post-heart attack care is undergoing a major transformation, with a strong focus on personalizing treatment for every individual. Instead of a one-size-fits-all approach, doctors are now looking closely at each patient's unique health profile, medical history, and risk factors to determine the best course of action after a heart attack. This shift is helping to ensure that patients receive only the treatments that are most likely to benefit them. For many patients, especially those who have not suffered significant heart damage, research now shows that beta blockers may offer little additional benefit in preventing future heart problems. This is a big change from previous years, when beta blockers were routinely prescribed to almost everyone after a heart attack. regardless of their individual situation. However, for people with substantial heart damage, heart failure, or certain rhythm problems, beta blockers remain a crucial part of their recovery and ongoing care. These medications can help protect the heart and improve long-term outcomes for those who truly need them. By moving away from unnecessary medications, patients are less likely to experience unwanted side effects, drug interactions, or the burden of taking pills that may not help them. This approach also empowers patients to have more meaningful conversations with their healthcare providers about what's truly necessary for their recovery. With fewer unnecessary medications, patients can focus more on lifestyle changes that have a proven impact on heart health, like regular exercise, healthy eating, stress management, and quitting smoking. These changes can make a real difference in preventing future heart problems and improving quality of life. Doctors are now encouraged to work closely with each patient, using the latest evidence and advanced tools to tailor treatment plans. This means considering genetic factors, test results, and patient preferences to create a plan that fits each person's needs and goals. The message is clear: embrace new evidence, trust in personalized care, and work together for smarter, patient-first treatment after a heart attack. This new era of care puts the patient at the center, ensuring the best possible outcomes for every individual.